Welcome to Ames Responds to COVID-19, a question and answer program where Ames residents ask area organizations their COVID-19 questions. I'm Susan Guiasa, the Public Relations Officer with the City of Ames. We have several questions that have come in this week, and we have several guests available to answer those questions. If you have a COVID-19 related question, please give us a call on our city hotline, 515-239-5670, or email us at covid19@cityofames.org. We'll try to get your question on our next show. The first question is one on a lot of people's minds these days. As numbers continue to increase of positive tests of COVID-19, I'm worried about how to keep myself and my family safe. What can I do? I'm going to pitch that question over to Rich Higgins, who is the Ames Fire Chief and also the coordinator of the COVID-19 response effort for the City of Ames. Rich, this seems like a good question for you.
It is. Yeah. Thanks, Susan, for having me on. And it's a question all of us should be asking ourselves, and we should ask ourselves daily. I think the most important thing we can do right now is stay informed. And one of the best ways to do that is really through the website, through the city's website, through McFarland, Mary Greeley, Iowa State University. We're all sharing information. It's also important to check out the state of Iowa's website. It's coronavirus.iowa.gov. They have great information out there that lets you know how your county's doing, the numbers, how many people are getting tested. We also have great links to websites, and we have all that stuff on our website as well that you can check out. So staying informed is probably the most important thing that you can do to keep yourself and your family safe and your neighbors safe. Some other simple little things you can do is wear a mask. I cannot promote wearing a mask. This is the new social cool, if there is such a thing as being cool these days. Wearing a mask, I love it when I see other people wearing a mask because I know that they're doing their part. Not a whole lot to it. It's just a little piece of fabric. In fact, here at the fire station, this is just some old T-shirts that we had that for Commander Tapper and her daughter took them as a project and sewed them up for our department. Pretty easy to do, but it provides so much protection for those around me. That mask doesn't really provide me a whole lot of protection, but it does provide protection for everyone else around me. And that's what I want to do. I want to do my part to help keep everybody else healthy and safe. And I take a lot of pride in that, and I hope our community does too, knowing that, hey, I'm doing my part for my neighbor. I'm doing my part for the hospital. I'm doing my part for my grandparents, for the long-term care facilities. If we all do our part, we can get through this pretty easy. So wearing a mask is another thing that you can do. Social distancing, I know it's tough. I miss seeing my parents. I miss seeing my grandparents. I can't wait to hug them someday. And I know there's a lot of healthcare workers out there that have only seen their families through windows. And I can only imagine how difficult that would be. But they're doing their part. They're maintaining that social distance. So when you're in line at a store, when you're at work, just remember that 6-foot rule. I always like the 7 or 8 foot rule. I just feel a little more comfortable with that. And I'm not really good at gauging 6 foot. So if you go 8 foot, you know you got yourself covered in there. Just maintain that distance. Allow people time at the registers if they're in front of you. Stay back. A lot of the stores have done a great job. I know City Hall, we've done a great job too when we get ready to open up next week of having our markers out that show 6-foot distances. I know hospital and McFarland Clinic are doing some of those social distancing steps as well. So those are 3 easy things that you can do is stay informed, wear a mask, and social distance. Some other general tips is if you don't feel good, stay home. That should be the general rule any time of the year, but especially now with COVID. Many of the symptoms mimic the flu, mimic seasonal allergies. Don't take a chance. Just wait them out. Stay at home for a couple of days. Monitor your symptoms as well. We encourage people to take your temperatures twice a day. Even if you're feeling well, we know that this disease can produce asymptomatics. People that have no signs or symptoms that they're sick, but by taking your temperature, that might clue you in that, hey, I'm normally a 97.8, but today I notice I'm around a 99, and I kind of have a sore throat. I'm going to stick it out at home and just wait a day or two just to make sure this doesn't develop into something worse and expose other people at work. So if you don't feel well, stay home, help your team out. Susan, if I could, one more thing I just want to share about staying informed. I want to share the numbers with you too of what we're seeing. This is from the coronavirus.iowa.gov website. 2 weeks ago, we saw our caseload was 173 cases in Ames, and we had about a 4.7% positive rate. Last week on the 15th, Monday, we were up to 252 cases, and our positive rate jumped up to 6.1. This Monday, on the 22nd, we were up to 471 cases and 8.3 for our positive rate. So obviously we're on an incline right now, And I think if we can all do our part by staying informed, wearing the mask, the social distancing, and staying home if we don't feel well, we can help bring those numbers back down into check to where they're manageable and we don't overload the hospital with people getting sick.
Wow, Rich, that's some really great information, great advice. And when we talk about as a community being in it together, I think that's exactly what we need. We're all in this together because our actions do impact other people. Thanks, Rich. So if you're in that situation where you think you should be tested, I'm going to ask Steve Sullivan with Mary Greeley Medical Center, what do you do if you think you should be tested?
Hi. So why might you feel like you should be tested? Well, perhaps you're experiencing symptoms, cough, fever, sore throat, loss of smell, loss of taste, those much reported symptoms of COVID. Or perhaps you are concerned that you've had exposure to someone who has had a positive COVID test. That exposure, when you're thinking about it, it would be someone that you know has had a positive test and that you've been closer than 6 feet to and for longer than 15 minutes. So those are kind of some criteria to be thinking about. We always recommend people start with their primary care physician, call there first. You could also do Test Iowa, or you could call the McFarland hotline, if you will, at 500-6711, 500-6711. You can walk through your concerns, and the people who answer the phone there can provide direction as to whether or not you would probably qualify for testing. Most organizations that are providing this kind of direction are following CDC rules. So there aren't enough tests really for just everybody to get tested. So there are these criteria that might have to be followed. When a person gets a positive diagnosis, a positive test back, they are typically contacted first by their primary care physician and with follow-up from county health officials. So when they do contact tracing, that is people who the person with the positive test have been around closer than 6 feet, more than 15 minutes, those folks will be contacted and be informed that they may have been exposed. And that is also another reason to perhaps pursue a test. While we are seeing the numbers increase significantly over the past several weeks, that has not manifested into more cases in the hospital. We actually only have a few. We have one of the lowest rates of hospitalization we've had in some time. We've been as high as 13. Right now we have just a few. So that's the good news in this troubling trend.
Low hospitalization rates, but the positive tests are on the increase. So things that we all need to do. Both great advice from Fire Chief Rich Higgins, and thank you, Steve Sullivan with Mary Greeley Medical Center. Some good advice on what you can do, some next steps that you can take. Ames Responds is an opportunity for Ames residents to ask their COVID-19 related questions. If there's something that you're curious about and would like some more information, please call our COVID hotline at 515-239-5670 or email us at covid19@cityofames.org. Just a reminder, city facilities will be reopening on Wednesday, July 1st. Our expectation is that our citizens that visit us at city facilities will be wearing masks. We'll have hand sanitizer stations located around our facilities, and we'll have a lot of directional signage so you know exactly where to go and where to stand and how to proceed. We're looking forward to seeing you on Wednesday, July 1st. Just a reminder also that COVID-19 information can constantly be changing, and make sure that you're checking local news sources for the most current information. We have information available at our City of Ames website, cityofames.org/COVID-19. Obviously, Mary Greeley, McFarland Clinic, the Iowa Department of Public Health, the CDC, and others have up-to-date and accurate information. Thanks for watching.